At Prevent Blindness, we promote healthy vision and access to eye care for all. We educate people about protecting their sight. We advocate for strong vision policies at the local, state, national, and global levels. We empower the blind and low vision community and their allies, and we celebrate their achievements. Here's your host, Christopher Hord.
Greetings and welcome to the June 2025 episode of the Focus on Eye Health podcast. I'm your host, Christopher Hord. We are all aware that there has been a great deal of uncertainty about the availability and levels of federal government funding and how it will affect services for all Americans. In this special episode, Sarah Brown, Prevent Blindness Senior Director of Government Affairs, leads a roundtable discussion on how these issues might affect medical research and impact the blind and low vision community. Additionally, we'll take a look at the new Disney Pixar movie called Elio, whose main character has a vision-related condition. You'll also hear information about Prevent Blindness's innovative advocacy program, Aspect, and how you can get involved. Finally, we share information on cataract awareness and offer tips on fireworks safety. We hope you enjoyed this month's episode. It starts right now.
News.
The new Disney Pixar movie, Elio, opening on June 20th, features an imaginative 10-year-old boy who has trouble fitting in. Among the details that make Elio stand out is the fact that he regularly wears an eye patch. That eye patch is significant to millions of children around the world. It is emblematic of a condition called amblyopia, also referred to as lazy eye. It is estimated that up to 4% of children worldwide will experience amblyopia, according to Dr. Sandy Block. Dr. Block was co-chair of the Prevent Blindness National Center for Children's Vision and Eye Health. She is also a board member emeritus of Prevent Blindness.
So amblyopia, which is often referred to as lazy eye, is a situation where a child has some reason for not using that eye, and the visual acuity, or how well we see when we talk about 20/20, decreases. And even with the appropriate correction, whether it's contact lenses or spectacle lenses, the child is not able to see 20/20. There's lots of different levels of amblyopia. Some of them are mild, some of them are much more severe.
Many children who need to wear an eye patch suffer from a negative self-image. Prevent Blindness is one of many organizations that hope that this movie can provide a positive role model that children can relate to.
We have many parents that allow the child to color something and put it over the patch, or the idea that if you wear your patch the appropriate time, we could put a sticker on a calendar. There needs to be some reason for the child to understand, why are you doing this to me? I can't see as well with this eye as I can with the eye that's under that patch. So there needs to be some reinforcement.
Elio from Disney Pixar opens in theaters on June 20th. Prevent Blindness receives no compensation from Disney or Pixar for this story. There's still time to apply for Prevent Blindness Aspect program. The deadline to apply for Prevent Blindness Aspect program is August 14th. It has been said that the patient is the greatest untapped resource in healthcare. Aspect is an innovative program created by Prevent Blindness to improve medical outcomes for blind and low vision patients by engaging them in the process. Aspect stands for advocacy, support, perspective, empowerment, communication, and training. Aspect helps teach its members to use their personal stories for self-advocacy. It gives them the tools to interact with medical professionals, policymakers, and more. The upcoming cohort has several members of the blind and low vision community already enrolled. They are especially seeking healthcare professionals, allies, caregivers, parents, policymakers, and others to join as well. For more information, check the Aspect page at our website, preventblindness.org, or look for the link in our show notes.
Feature presentation.
Hello, everyone. Welcome to another podcast episode with Prevent Blindness. I'm Sarah Brown. I'm Senior Director of Government Affairs with Prevent Blindness, and I'm joined by two colleagues in the vision and government affairs space. To my left, I have Philip Goglis, who is a managing partner with Health and Medicine Council, and this is an organization that we partner with quite a bit on our advocacy and government affairs work. And to the left of Phil is Dan Ignashevsky. Hope I got that right, Dan. Dan is Executive Director of the National Alliance for Eye and Vision Research, and Prevent Blindness is a proud member of the National Alliance. And so we are all here today to talk about something that we're keeping our close eyes on in Washington, D.C., and that is the federal budget and appropriations process for this year. As everybody knows, we are in the fourth month of a new administration and a new Congress that was elected last November, and we are seeing quite a few changes that are really affecting a lot of the policies that we advocate for with vision and eye health on the research side of things as well as the public health side of things. So I wonder, Phil, if you could maybe start with just giving us a lay of the land with what we're seeing in Washington, D.C.
Thanks, Sarah. As Sarah mentioned, I'm Phil Goglis. I work here in Washington, D.C. on behalf of Prevent Blindness, really as, no pun intended, the eyes and ears for PB on anything and everything related to Congress or federal agencies. So where we are today in May is still at the height of the appropriations process, with the Congress coming together and working on figuring out what they should be supporting, how much they should be funding each federal agency at, as part of the broader legislative activity as well. We do have the House working on a reconciliation package, conversations about cuts to Medicaid and different changes to that program. Also across the federal government as well, looking at making numerous cuts. We continue to monitor that situation and see how that's going to unfold. And the reason why they're going through this reconciliation process is because you don't need a supermajority in the Senate to pass. You just need a simple majority. And we know that Republicans having 53 seats in the Senate have that majority. Republicans in the House have a slim majority as well. But there is a lot that goes into the decision-making process and figuring out how they're going to move things forward. So where we are now is a key time for advocacy. It's always a good time to advocate. It's always a good time to share your story. But against the backdrop of those larger issues that are going on here in Washington, we've been very active with our own legislative priorities, specifically the EDV Act. And I'm sure we're going to talk a little bit more about that. But that's something that we reintroduced earlier this year before the reconciliation process started with our champions, Congressman Gus Bilirakis and Congressman Mark Vesey. And we've been very focused on continuing to gain support for that bill in a bipartisan way, and are doing a lot of good work to advance that through the House, but also working on a Senate companion bill as well. So if you're listening or watching us today and you haven't signed up to be an advocate with us, please go to our website. Please look at all the advocacy tools that we have available, and please do sign up so that way you can use your voice on behalf of our community and make sure that your House member co-sponsors the EDV Act, or your senator works to help introduction for that.
Prevent Blindness ourselves detailed a lot of what we were seeing with some of Secretary Kennedy's reorganization of HHS and some of the administration's new policy proposals around the new proposed administration for a healthy America. And that really, as advocates, we do have to take that information in and sort of take it in stride. We always have to kind of get our sea legs under us when there's a new administration and a new Congress. But I think Dan, especially looking at things that are happening on the NIH side of things, and Phil working with clients that are also looking at what's happening in the research side, sea legs is definitely, we're going to need something a little stronger to handle all the changes that we've been seeing, and understand just as advocates how to actually work with some of these changes and see where there's some opportunities and some challenges. So Dan, I would love to hear from you about what you're seeing just with our research and vision community, just on the NIH side of things.
Yeah, it's definitely a busy time. I think, like Phil said, there's obviously a lot of changes happening right now at the federal level, and that's certainly the case across Health and Human Services and specifically at NIH. We've seen a number of NIH staff have been let go through the RIF that happened earlier this spring. And we're also seeing delays in grant funding, a lot of challenges there. I think we're sitting on about $1.5 billion in funding that has yet to go out the door, that is typically out the door by now. And so, that money goes to research projects. It goes to support research institutions and really life-saving, life-altering research that is having a positive impact on patients. And so we've been concerned with some of the delays in the funding. We've seen cancellations of some grants, particularly those that are around the DE&I issues, as well as some of the things around vaccines. There have been a few canceled that are in the vision research space as well. And so we're tracking and monitoring those, raising concerns where appropriate to try to address some of those things. But then I think beyond that, we also saw the president's budget drop just recently. And when the president's budget request came out, as RFK Jr. is testifying on the Hill today in support of that budget, we see substantial changes to NIH. First and foremost, there's a nearly 40% reduction in funding across NIH. That will obviously impact vision research as a whole, the work that can be done in that space. But it's not just vision, it's sort of across all of biomedical science. In addition to that, there's a recommendation within the budget to go from 27 existing institutes and centers down to 5, eliminating all existing centers, consolidating them, and consolidating the different priorities within those 5 new centers. Vision would be consolidated under the proposal. If it were to pass, it would be consolidated with neuroscience and brain research. And obviously, neuroscience and brain research is very important, but that doesn't include vision in the name or the title. And so we think that there's a big risk for vision research to get lost in the shuffle with some of those consolidation approaches. So those are 2 big issues, the major cut to NIH that's being proposed, as well as the consolidation. The last thing that I just mentioned is dating back to February, there was a proposal to cap indirect rates on research projects that would cap those rates at 15%. Currently, those rates average about 30 to 35% across the United States for different research institutions. Some are up into the 80s, and some are lower than that, obviously lower than the 30%. But there's sort of a very wide discrepancy on those indirect costs across institutions. And so the administration is looking at trying to cap those at 15%. That is currently in the court systems. It's got an indefinite injunction right now to stop that under the district court. But the administration has signaled their plans to appeal later this summer and continue to try to implement that 15% indirect in their FY26 package. So those are some of the big concerns. If those indirects go away, it's kind of been the way that NIH grants have been operated with indirects has basically been largely unchanged since 1965. And so we had a long history of them where the grants, the indirect rates are negotiated between the institutions and the federal government. This kind of came out of the blue and was implemented or was planned to be implemented back in February, sort of overnight. We've got to stay on it, but it is something we're continuing to monitor and track, because I think there's a real need for advocates who support research and support the promise that research can provide. Advocates really need to take a stand and step up and get engaged on some of these issues.
What are some of the messages that you're bringing to members of Congress? In the past, we've seen a lot of support from the Hill for all 27 institutes of the NIH, and now to see them, truncated down to 5, members must have some thoughts about that. What are you hearing from them?
Yeah, we're definitely, I think there's some significant concerns, especially in the Senate, around the consolidation. Last year, in 2024, there was a proposal in the House to consolidate those 27 institutes down to 15 institutes. That ultimately did not pass, and it was largely because the Senate kind of came together with bipartisan support and said, we continue to value the work of all of the 27 institutes and centers. We want to make sure that we're recognizing that work and basically maintained level funding across NIH with the package that was passed last year or passed earlier this year to fund the government. So, we're continuing to share the message around the importance of research, the fact that research is what's leading to new discoveries. Those discoveries are providing opportunities for better and earlier diagnosis, improved treatments and methodologies for care, and hopefully cures. And even more recently, there's been some major advancements that are talking about reversal of vision loss within the research space. And so, we try and help people on the Hill and policymakers understand there's a lot of value and potential there that can fundamentally change and improve people's lives. And we want to make sure that we continue those research efforts so that as we project a doubling of many vision conditions over the next 25 years, that we are adequately prepared to be able to handle that and respond to that. Frankly, from an advocacy perspective, we can't do it without the patient voice. And so that's why Prevent Blindness as a partner is so important, because without the patient voice, without people who have experienced vision loss and are caregivers and partners with folks who have experienced vision loss, without those stories, members of Congress largely, don't understand or truly see the value and the impact that research can have. And so those patient stories and patient perspectives are incredibly valuable in our advocacy efforts today.
And kind of what we're seeing just on the CDC side of things, Prevent Blindness, and I would like to say that we also have an advocacy alert that is in support of NAVER's policy proposals and recommendations. So definitely encourage advocates to take a look at that action alert. But NAVER is really the expert on vision research and just what that means for the vision community. But we're seeing a lot of the same similar circumstances on the CDC with some of the administration's proposals. Prevent Blindness has long advocated for a small pot of funding at the Centers for Disease Control and Prevention, the Vision Health Initiative. And that funding is now at about $6.5 million. And, this is the one program within the federal government that conducts a lot of surveillance, and surveillance by any other term is data collection. Data collection is incredibly important because it not only helps us to understand how many people in our country have various conditions such as diabetes, related eye conditions, glaucoma, age-related macular degeneration, even refractive errors, low vision, visual impairment, and blindness. But that information can really help us to understand how many people in our country may not be aware that they are at risk of vision loss and how they can get connected to care. Is it something that we're experiencing on the workforce side? Is it, a lack of providers in their area? Do we need stronger telehealth policies? Or, is this something that even AI can fill in the future when you're talking about rural populations and populations that are not connected to an urban center or a major medical center of some kind? And without really understanding, just from the data that we're collecting through the CDC, what our risk profile is and what our current burden and scope of vision loss in our country is. Without that funding, we really will be setting vision health back about 30 or so years to a time before we had smartphones and we were all staring at them all day, every single day. And we had new stressors on our vision, and, we're seeing a rise in chronic disease, and we're all aging a little bit quicker. So it really is something that we're taking the time with Phil and his team to talk about, what these programs actually do, why they are important, and, why they deserve to be a mainstay within CDC, and especially given the administration's push for ameliorating our chronic disease burden in this country. So, Phil, I'm wondering if you can give sort of a state of play just from, what happens from here, just, who has the final say in some of these policies that we're saying, and, what else can advocates do to really help to, bring awareness to these programs and inform members of Congress of their value?
A lot of what we've seen from the executive branch with executive orders and things like that, that's not final. The executive branch does not have the authority to eliminate federal agencies like the Department of Education, or to unilaterally reorganize national institutes of health. All of that requires an act of Congress. So there are proposals out there from the administration and budget requests that propose to eliminate agencies, but also institutes at NIH, such as the National Institute of Minority Health and Health Disparities. But the administration can't do that on their own. That takes an act of Congress. Congress was the one that created that institute, over 16 years ago at this point. I'm proud to say that we were part of that creation of that institute at NIH. But the work is critically important in Congress, and that's why it's very important for folks to get involved, because members of Congress, whether they're in the House or the Senate, they want to hear from their constituents. All domestic funding was frozen early this year for quite some time, and as soon as that happened, stakeholders immediately reached out to their senators, to their House members, talked about the implications, because while at the end of the day we are talking about dollars and cents, we are talking about people, and we are talking about the effect that this has on individuals. And if we're looking at NIH cuts, you're talking about research institutions, you're talking about jobs, you're talking about universities. When you're talking about research itself, we're talking about discoveries that will make America healthy, or healthier. So when you have these types of decisions that are being made, it's really important that you, as an advocate, as you don't even have to be a voter, but just somebody who lives and is affected by these decisions, it's important for you to make your voices heard. And that's what we're seeing going on right now with reconciliation. There's been a large uptick in outreach from folks about hands-off Medicaid, about their state and local tax deduction. And that's why you have a large group from certain states that are no on the bill until that need gets addressed. They're responding to the issues that their constituents are bringing to them. So while it is important and we do engage with federal agencies, we engage with NIH on a leadership level, with CDC, it's really important to engage with Congress, because as part of the appropriations process, they not only fund federal agencies, but they provide specific recommendations as well through the report language process that tells agencies what they want them to do.
I always like to try to end things on kind of a positive note. Is there anything that NABOR is working on aside from appropriations? That's anything that you're hopeful about with your organization and some of the changes that we're seeing?
Yeah, I mean, I think, one of the things that we're really focused on and working with our partners like Prevent Blindness, one of the things that we're really interested in is identifying opportunities and ways that we can elevate vision as a national priority. And so we are working on a campaign that we're going to be rolling out this summer around we're calling it the See What Matters campaign, and it's basically trying to connect all of these different vision loss conditions and vision impairments where it helps people understand what people might experience with vision loss and how they can have a positive impact on policy issues that are trying to be addressed with Congress, from NIH to CDC to the EDV Act and more. So I think we're excited about rolling that campaign out this summer and working with our partners to further that. Would love the community to get involved and rally around that as well. Again, sharing your stories and sharing your experiences with that opportunity as we roll it out. But I think that, I think Phil kind of hit on it too. There's a lot of hope, I think, for, systems to be in place, and bipartisan support, I think, is really necessary, especially in the Senate. We're going to need 60 votes to pass a budget, and that's what's going to be required to pass a lot of these changes that are being proposed. While the Republicans do have a majority, and we don't have the Republicans don't have 60 votes in the Senate to pass something all by themselves, with the exception of reconciliation. And so some of these bigger changes, the restructurings, the significant cuts and reductions, it's gonna have to hit that wall in the Senate and find out whether or not that support is there. And I'm confident that our institutions are strong. And I think that within the Senate especially, we're already seeing with some of these NIH hearings a lot of bipartisan concern around these things, around the consolidation, the 15% indirect cap, the cuts. It's not a partisan issue. There's historically, research funding has always been bipartisan. That with Congress continues to seem to be the big focus is bipartisan support for biomedical research. And from that perspective, I think there's a lot of value there and a lot of opportunity.
And for Prevent Blindness, and Phil, you and your team have been instrumental in helping us with the EDV Act. I'm going to take moderator's privilege here and talk about that. But we're so excited about the early detection of vision impairments for children, or the EDV Act of 2025. We had this introduced in the last Congress about a year ago, and at that time we had about 18 organizations sign on in support, and we only had our two co-sponsors, Congressman Gus Bilirakis, Republican from Florida, and Congressman Mark Vesey, Democrat out of Texas, supporting this bill. And at the end of the prior Congress, we had 10 co-sponsors, 5 Republican, 5 Democrat, and almost 100 organizations across the United States that support this, including Dan's organization, Neighbors. So we did just have this bill reintroduced at the end of March. Congressman Bilirakis and Congressman Vesey also led on that as well too. And we are just in the process of starting to get co-sponsors and really start to push this bill forward. But I'm always encouraged, Phil, and I'd love to hear your perspective on this.
And to not oversimplify it, it's really just that personal connection. Blindness is not a partisan issue. Everybody wants to see. I don't think anybody wants to live in a world where their children go blind, or their family members go blind, or they go blind. So I think it's important to rise for us to always be aware of the politics of the day, but not be consumed by it, because it's important. And to your point, Sarah, we work very closely with Republicans and Democrats. We have a strong bipartisan base of support, and we're looking to continue to grow that. So there may be differences philosophically for members on how to approach or how the government should work. But at the end of the day, as you said, there are countless times when we go and we share information with a staffer and they say that somebody who they know has been affected by it. Members will share that they have been affected by something. So it's always important to make that personal connection. And I don't want to, again, oversimplify that point, but it really does make a difference, because members do want to hear from you. So if you go in and say, here's something that you can do to help address children's vision, we've never been in an office where a staffer or a member has said, no, I don't want to address children's vision. No, I don't think that's a good idea to help children see. No, I don't think it's a good idea to make sure people don't go blind. I've never heard that.
Thanks, Phil. And as positive as I feel about the EDV Act and these conversations and those positive bright spots in all these conversations that we're having, it is still going to take the effort of the advocacy community, the vision and eye health communities. So definitely encourage everyone to check out our website. I'm sure we'll do a podcast episode detailing what the EDV Act is. But for now, the best thing anybody can do is go and send a message to Congress, tell them that these issues are important, and get involved and stay informed. So with that, I would love to thank Phil and Dan for being here, especially with everything going on. I know your time is valuable and your work is valuable, and we appreciate that you're a part of this with us, and look forward to continuing the conversation, hopefully with some continued good news on the funding front in vision and eye health. So thank you so much.
Announcements.
June 28th to July 4th is Fireworks Safety Week. According to the U.S. Consumer Protection Safety Commission, close to 10,000 people had fireworks-related injuries that required hospitalization. These numbers are for 2023, the most recent year with numbers on record. Additionally, there were 8 fatalities. The vast majority of fireworks-related injuries take place in the month surrounding the 4th of July. This is why Prevent Blindness observes Fireworks Safety Week from June 28th through July 4th. Prevent Blindness warns that there is no safe way for non-professionals to use fireworks. The safest way to responsibly enjoy fireworks is to go to a professional display. Don't let children play with fireworks. Because of the dangers associated with fireworks, Prevent Blindness has created a dedicated web page with resources on the topic. Resources include safety tips, steps that can help save a child's eyesight in case of an accident, and fact sheets that you can print out and take with you. For more information, please see our website or follow the link in our show notes. This June, Prevent Blindness observes Cataract Awareness Month. A cataract is a condition that causes the clouding of the eye's lens. This blocks or changes the passage of light into the eye. Although it can occur in people of any age, it is most commonly associated with advanced years. The National Eye Institute estimates that more than half of Americans age 80 or older have had cataracts. This is why Prevent Blindness observes Cataract Awareness Month in June. We also provide a variety of resources that are helpful to people with cataracts or who might develop them. We offer a page at our website, preventblindness.org. The page includes videos from our Focus on Eye Health Experts series, fact sheets, and graphics to share on social media. We also feature a list of financial resources for those who might need cataract treatment or surgery. You can also find a link to those resources in our show notes.
Listen to the podcast from our website at preventblindness.org or subscribe to it on all major podcast services, including Amazon, Apple, Spotify, and YouTube. This has been your announcer, Corey M. Snow.
Thanks for listening. Please join us for next month's episode when we'll discuss mindfulness. What is it? How can it help your mental health? And how can it be especially useful to members of the blind and low vision community? And we'll share helpful resources we've gathered as we observe Dry Eye Awareness Month. As always, we'll have more news, features, and announcements of interest to the blind and low vision community and those who work with them. Please subscribe to the Prevent Blindness Focus on Eye Health podcast from your favorite podcast distributor. If you have a smart device, try asking it to play Focus on Eye Health podcast for you. Have comments or tips? Contact us by emailing podcast@preventblindness.org. We can't reply to every email we receive, but we read them all. Enjoy and share.